Be ready. 5 seconds.
Friends, the bill that I am presenting today has the potential to create a paradigm shift in healthcare delivery of the future by recognizing the specialized skills and contributions of more than 56 types of healthcare workers, that is, the allied and healthcare professionals. A major paradigm shift is being effected in healthcare service delivery, embracing a multidisciplinary care model. We all are witness to the developments along COVID 19 in this country in the last 1 year. COVID 19 has highlighted the invaluable contributions and sacrifices of these professionals in their frontline, risking their lives every day selflessly fighting the pandemic. The invaluable role of respiratory therapists, laboratory technologists, psychologists, and physician associates, among several others, during these past 15 months cannot be overstated. During COVID, crores of blood tests and RT-PCR tests were possible only due to the skills of the lab technologists. The need for development and maintenance of standards of services and education of such professionals through a national regulatory body has thus been long overdue. These group of professionals are loosely referred to as paramedics. However, the fact is that paramedic is only one type of allied healthcare professional who is trained to handle emergencies in an ambulance setting. The group of allied and healthcare professionals is much larger, and we are bringing in a law to reform and regulate this entire sector in order to give them their due through increased employment opportunities both in India and abroad, but more importantly, dignity in recognizing their true worth. Further, the potential of these professionals can be utilized to reduce the cost of care and to make quality healthcare services accessible to all. Colleagues, India is not only being looked up to as the vaccine manufacturing and pharmacy of the world, but also for our competent and compassionate health workers, doctors, nurses, and allied and healthcare professionals. By 2030, the World Health Organization has predicted a shortage of 1.8 crore healthcare workers in the world, of which almost half will likely be in the allied and healthcare professional space. Our 80 lakh plus strong healthcare workers today include a large number of allied and healthcare professionals who have the ability not only to contribute in a much bigger way at home but also as part of the global health workforce. Before I come to salient features of the bill, I wish to recall the long journey of this reform. During the decade of independence, several statutory bodies were established for what was understood then to be important professionals in healthcare: doctors, dentists, nurses, pharmacists, and decades later, rehabilitation related professionals. The Bajaj Committee specifically indicated the need for organized allied and healthcare professionals with the right skills and training to truly make a dent in the health system and provide the citizens with their constitutional right to accessible, affordable, and quality healthcare services. The first of such efforts to establish a regulatory body in India started over 2 decades ago when a bill for physiotherapists and occupational therapists was drafted in the early 1990s. Therefore, we moved away from a unitary structure for all health professionals, both regulated and unregulated, and the present bill is thus confined to regulating cadres not already covered by other regulatory bodies. I would also like to recall that former Health Minister of India, Shri Ghulam Nabi Azad ji, released a landmark report from paramedics to allied health, landscaping, and the journey forward in 2012 in this regard. We have strived to accelerate this reform by developing the framework and structure around the recommendations provided by the experts during that phase. The bill was modified to incorporate all the allied and healthcare professions in 2015. Sir, I will now come to the key features of the bill. This bill, once enacted, aims to establish a central statutory body as National Commission for Allied and Healthcare Professions. The Commission will frame policies and standards, regulate professional conduct, and prescribe qualifications for all these professions. The Commission will be supported by 10 broad professional councils, each comprising one or more professions. The institutional structure proposed in the bill enables assessment and rating of all the allied and healthcare institutions to ensure uniform standards and quality assurance. This also provides for registration of all the allied and healthcare professionals, facilitating their career growth and improving their employment potential both within and outside India. All the professions have been coded as per the International Labour Organization's international standards for classification of occupation, which also allow them for global recognition and mobility. A National Allied and Healthcare Advisory Council to advise the National Commission with representation from all the states have also been proposed to enable adequate representation from all states and union territories. Further, each state will be having a separate state council with 4 autonomous boards pertaining to undergraduate education, postgraduate education, assessment and rating, and ethics and registration. Since allied and healthcare professions include a wide variety of different professions numbering more than 56, a common regulatory body has been prepared for all these professions. We have carefully considered the invaluable inputs of the Parliamentary Standing Committee members and incorporated almost all of those in this bill. The year 2021 has been designated as the International Year of Health and Care Workers by the World Health Organization. I feel happy and delighted that in this very year we are considering a landmark legislation that will reform and open up huge opportunities for allied and healthcare professionals. As a doctor myself, I am personally elated that the National Commission for Allied and Healthcare Professions Bill will enable a team-based approach to care where the patient's well-being is the fulcrum around which several professionals operate. Through task shifting, specific tasks will now be moved to specialized allied and healthcare professionals for better reorganization of health workforce and improved health care. I therefore request all of you, call upon all of you to support this bill in solidarity and conclude its journey of more than 25 years.